our big focus. The mortality rate among infants and those under 5 years of age has improved, but malnutrition has worsened, according to the 5th National Family Health Survey report. Now, the report contains detailed information on population, health and nutrition for India and its states and union territories. It was released on Saturday by the Health Minister Harshvardhan. The survey is based on statistics from 6.1 lakh households in the country. So that's very large. It's significant numerically. While there are indicators of an improvement in maternal and child health statistics and indicators, there is bad news as well. For example, the proportion of undernourished children in 10 major states remains virtually the same. 35.7% in the last report, 35.6% this time around. The number of underweight children remains the same as well, at 34%. So what are the states we are talking about? Andhra Pradesh, Assam, Bihar, Himachal Pradesh, Karnataka, Kerala, Maharashtra, Telangana and West Bengal. Well, joining us now, Professor Jean Drèze. Thanks very much, sir, for being with us. Where in the last several years, since the last report, where specifically have we as a country failed in protecting our most vulnerable?
Let me first clarify these figures, because the averages that you mentioned are not exactly from the report. The report gives figures for states, including 10 major states. And yesterday I did a population-weighted average of the state-specific figures, and that is the averages that you have quoted, which show no improvement at all over a period of 4 years. And in fact, in 6 of these 10 major states, the incidence of stunting among children has increased, and in 7 out of 10 major states, the incidence of underweight has increased. So these are really catastrophic figures. This is quite a bombshell, and it's unfortunate that the mainstream media has paid so little attention to this. We should also remember, of course, that the baseline figures are also very high. I mean, already 4 years ago, India had some of the worst undernutrition levels in the world. In fact, no country in the world has a higher proportion of underweight children than India, except possibly Niger in Africa. And we have data for most countries, so it's not for a lack of data. So I think there's really a reason for alarm here, and all the more so because it supplements other evidence that we have of lack of progress in human development in the last few years. For example, we can see it in the slowdown of infant mortality decline. It did decline, as you mentioned, but at a slower rate than earlier. We can see also the stagnation or virtual stagnation of real wages. We have very worrying figures on poverty for 2017-18 from the National Sample Survey. So there's now a growing number of indicators that indicate that things are not going well at all. Now, coming to your question, what is going wrong? Well, I think firstly, of course, there is the economic slowdown, and I think it's more than a slowdown for a lot of people. Maybe the aggregate rate of economic growth is still not too bad, at least until 2019, not this year, of course. But for many people, I think for the last few years, things have not improved at all. The other thing is that the government, and particularly the central government, I think has turned its back on social policy, and in particular on children. If your objective is to become a $5 trillion economy, why would you bother with children? They have never been much of a priority in India, but I think now it's really quite startling how little attention is being given to them.
Professor Drèze, yes. Because someone was tweeting in over here asking a question. When you refer to these statistics, is there an age group of the children that you're referring to, or are you referring to those under the age of 18? And the linked question was, if it is children who are school going, is this an indicator that the midday meal scheme has failed in many of these states?
Right. So these figures that we discussed are for children below the age of 5. This is the most important age group, of course, and it's also the age group for which these anthropometric norms are most reliable. So it's not the age group for which the midday meal is relevant, but I'm very glad that you mentioned the midday meals in schools, because an illustration of the point, a dramatic illustration of the point I was making about the government turning its back to social policy and especially to children is the midday meal budget. In this year, the central government expenditure on the school meal program is only 11,000 crores of rupees compared to 13,000 crores in 2014. The budget is lower today than 6 years ago in money terms, and of course even lower in real terms and even lower in per capita real terms. And the same point would apply, I am sure, although I don't have the figures in my head, but the same point would apply to ICDS, the Integrated Child Development Services, for precisely these children below the age of 6 years. And if you allow me to say one more thing about ICDS and midday meals, here is what we need. Eggs in midday meals, in schools and anganwadis across the country. Some states are already doing it. Tamil Nadu, of course, for a long time, and now Orissa, Andhra Pradesh, many states, but there are still very many states, and especially, unfortunately, those that have a BJP government which doesn't believe in providing eggs in midday meals. They still need to catch up. This could do a lot of good to growing children. There's nothing better than eggs for growing children.
Okay.
So there are obvious things we can do at little expense for these undernourished children, but we have to pay attention to them.
Professor Drez, I understand what you're saying when you say that it's those up till the age of 5 who continue to be stunted and underweight, with a large percentage of those who've been served. But those children who enter the schooling system and enter the midday meal program, and I take your point that not enough is being done. That said, is there a perceptible weight gain? Is there a perceptible move away from undernourishment in those children in these states after they encounter midday meals?
So I think you are talking now of children above the age of 5 years.
Yes, I'm just asking if these children, once they enter potentially the midday meal scheme, is there an indicator of an improvement? I'm not suggesting the midday meal scheme is perfect, not at all.
Well, we don't have data. You see, the data that were released yesterday do not tell us anything for children above the age of 5 years. And also, as I mentioned briefly, the anthropometric norms are not so straightforward above the age of 5 years. So it would not be very easy to find data to answer the question you have posed, at least for the last few years. But I think, of course, it would be very possible to do surveys for this purpose. And that's what the government should be doing. We need a lot more collection of social statistics and nutrition statistics, all the more so now, because don't forget that everything we have discussed so far applies until the COVID-19 crisis. The
right, and it's bound to suffer after that. Yeah,
exactly. It's almost bound to be even worse this year. So there's an urgent need to collect social statistics, not only on nutrition, but also on employment, on health, and so on, to find out what is happening to the vulnerable sections of the population and to do something about it.
Now, there is a statistic which I know you're a bit wary about, because some of these comparisons can be odious. But I do believe that it's important to look at the proportion of underweight children in India compared to other countries in South Asia to look at where we actually stand. Again, it's not an apples for apples comparison, because each country is different. But that said, how are we failing, Professor Drez, as compared to other countries in our region? Because we like to compare ourselves to others and say, look, we are doing brilliantly in South Asia. That's not the case.
Right. So, as I mentioned earlier, no country in the world, except possibly Niger in Africa, has a higher proportion of underweight children than India. That implies in particular that the levels of child undernutrition, at least by that indicator, are higher in India than in all the other South Asian countries. They are higher than in Bangladesh, higher than in Nepal, and of course higher than in Sri Lanka and Bhutan. If you look at stunting, according to the most recent data available, Pakistan is more or less neck to neck with India. But if you look at underweight, then India is the worst. You may know that there used to be something called the South Asian enigma in the literature on nutrition, which referred to the fact that South Asia had the worst undernutrition levels in the world, and in particular, or at least among the worst at that time.
Yep.
And in particular, the undernutrition levels in South Asia were no better than in many other countries that were much poorer in terms of per capita income. That was the South Asian enigma. But now, on top of that, we have an Indian enigma. Why is India doing so badly within South Asia, and in particular worse than countries like Nepal and Bangladesh, which are poorer?
Okay.
In fact, in the case of Nepal, much poorer in terms of per capita income. Now, that is an unresolved enigma. I will not give you the clue.
Sure.
But personally, I suspect that it has a lot to do with inequality, and in particular with gender inequality and the extreme disempowerment of women in India, in particular pregnant and nursing women. We had a really striking taste of that last year when we did a survey of pregnant and nursing women in 6 states of India. And it's just extraordinary to see how the special needs of pregnancy are neglected within the family, and the extreme disempower that these women face.
Sure.
So you can imagine that that would make it difficult to improve child nutrition. And similar remarks apply to caste inequality. How do you run an Anganwadi in a small village which has different communities that will not get along with each other and cooperate with each other? It's a very serious problem, not just for Anganwadis, but for all public services, local public services in India.
So, Professor Dres, now we've spoken about this, and Harshvardhan, the health minister, had to say, and the government pointing out what it believes are some important positive factors. This is his quote. Here's what he says: substantial improvement in maternal and child health indicators over the last survey was recorded in the present survey. How? The fertility rate has further declined, contraceptive use has gone up. The survey found considerable improvement in vaccination coverage among children aged 12 to 23 months across all states and union territories. Women's empowerment indicators, including women with bank accounts, also portray considerable progress. What is your analysis of what the minister is saying here?
Well, it's certainly true that there is progress in some areas. Over time, things do normally tend to improve, and that is why it's so shocking that the child undernutrition rates are not improving. But if you look at the rate of improvement between NFHS 3 and NFHS 4, that is between 2005-06 and 2015-16, for the first time in India, we had actually seen quite a rapid progress of many social indicators, and that is reflected, for example, in the fact that about half of the proportion of the population in what is called multidimensional poverty, which takes into account various kinds of deprivation, the proportion of multidimensionally poor households declined by about 50% in that period. So we had a sustained period of accelerated improvement, at least compared to the very slow improvements that we were seeing earlier. So there was an acceleration just before the NFHS 5. And now I think, despite continued progress, we are likely to see slowing down of the improvement, and in some cases like child nutrition, actually no improvement at all.
Well, it is startling, and it's very, very worrying in these key areas as far as children under the age of 5 is concerned. Undernourishment and stunting, the weight of children remains such a huge concern, and that doesn't augur well at all for the lives of millions of our citizens. Thank you, Professor Dres. It's always a pleasure to speak to you. Thanks very much indeed.
Thank you for having me, and let's not forget the eggs.
The egg in midday meal schemes, absolutely. Thanks, Professor Dres. Thank you.